Hi guys, I'm coming to you from my messy garage. Okay, so I know last time I made a video, I was scared about having a possible spinal tumor. So here's the thing. I got my MRIs back, so I had 3 MRIs done. One of my cervical spine, one of my thoracic spine, which is the mid-back, and one of my lumbar spine. So for many of you watching, you guys already know that I have fibromyalgia, which is a chronic muscle, nerve and joint disease that causes widespread pain in those muscles, nerves, and joints. There's a host of symptoms that go along with having fibromyalgia, which I covered in another video. From fatigue, mood swings, memory loss, brain fog, joint, muscle, nerve pain, a lot of things which I have, all of the above: fatigue, brain fog, mood swings, muscle pain. I even have some hair loss, and it's getting progressively worse. I was first diagnosed 2016. But I know I've had it for way longer than that. It's just they never knew what was wrong with me. So I still experience fatigue. I have a lot of muscle, joint, and nerve pain. I do take medication for that. But I also have severe spine issues. I'm in pain every day. I cannot stand for long, can't walk for long, can't run, can't hike. Can't get on my knees to play on the floor with the kids, having difficulty picking up my 25-pound daughter, and I'm just kind of looking for a solution to the back pain. Fibromyalgia is incurable. There's nothing I could do about it, but I'm trying to manage that. The back pain, I cannot manage. I'm losing sleep. I'm in a lot of pain. I knew I had issues. I've gotten 20 injections in my lower back, my lumbar spine. I've had 8 epidural steroid injections, 8 sacroiliac injections, and 4 medial branch blocks. None were effective. Because I do have problems in my lower back, it's causing me sciatica. Mostly down my right leg and my right buttock cheek. When it gets really bad, I can't drive because if I flex my foot to either press on the gas or press on the brake, what will happen sometimes is I will get an intense muscle cramp, when your leg just jams up and won't release. And that happened to me one time when I was driving and I could not stop the car. I had to put the emergency brake on in the middle of the street, and all the cars behind me were honking and calling me names, cursing at me. They had no idea that I couldn't stop my car, so I had to put the emergency brake on. I had to get out of my car and try to shake out the cramp. Of course, I was hysterical because I had to put the emergency brake on going 40. And so the car just jerked to a stop, and people, of course, behind me had no idea what was going on with me. I got out the car, I shook off my leg, and after about a good 15 minutes, when it released, I was able to drive back home hysterical, and that occurred before my first set of injections. It hasn't ever gotten that bad again, but I do feel every now and then my calves and my feet cramping. I do not think it's because of the fibromyalgia. I do think it's because of the issues going on in my back. So the last video I posted, I was scared that I might have a tumor because of the masses that were seen on my spine during the MRI, because I checked the CD. So I do have the reports here, and I went to my neurologist. He says, yeah, your back is bad, but not bad enough for surgery. So have a few more injections and mess around with muscle relaxers until you find one that works. Needless to say, I wanted to choke him, and I'm never going to go back to him. You don't tell a patient to mess around with muscle relaxers and get more injections. Injections are not only painful, it's risky, and it's costly to get them because every time you get one, you have to pay a copayment. The sacroiliac injections that I received, all 8 of them, I had to be put asleep for that. And then my copayment was like $400. That's with insurance. And it was painful as hell. When I got up, I can barely walk. And then that night, I was in severe, excruciating pain. And then there was no relief. They didn't work, so I received 8 injections for no reason. So to have a neurologist tell me to just go ahead and get more injections and play around with muscle relaxers, why do you have a license? Why are you working as a doctor? That's not, and I did become very upset with him as he's talking to me. Well, everybody has bed bags. There's a lot of people with bulging discs. There's a lot of people with herniated discs. Just mess around with muscle relaxers. And I told him, with all due respect, stop generalizing. Stop saying that everybody has this or I'm not everybody. And I'm telling you, the pain that I'm in is not pain that I can deal with for the rest of my life. I'm only 37 and I'm having trouble sleeping and I'm having trouble picking up my 25-pound 2-year-old. I can't walk for long. I can't bend down. Injections are not helping me. I don't want to be on medication for the rest of my life. It's ruining my stomach and my liver. I do take muscle relaxers already. I do take a very low pain pill. Some doctors don't even consider it an opioid. And I'm taking a nerve medication. I'm taking those 3 medications daily. It's not even covering my back pain. It doesn't touch my back pain. I was thinking about speaking to my pain management doctor, because I do have a pain management doctor, to see if he'll change my medication. But then again, that's a Band-Aid solution. My back is degenerating. My discs are like incinerating, if I can say that. I'm in so much pain. So I won't see that neurologist anymore. Then I went to a neurosurgeon at Cleveland Clinic in Florida, and he said, yeah, your back again it's got a lot of stuff going on at multiple levels, but I wouldn't clear you for surgery. He said sometimes the surgery can cause more harm. At this point, I'm in so much pain. And he again said, you know what? I'm just going to do another epidural injection in your lower back and see if that helps a little. But I have pain in my mid-back where I clasp my bra. I actually can't wear a regular bra. I have to wear sports bras. I've been wearing sports bras for months. Probably over a year. An injection is not going to help me. I've never had an injection in my mid-back. Only 20 in my lower back. He's telling me he wants to give me another injection in my lower back. And so I said, what do I do with the pain? Because the injection is not going to help me. And he said, well, I'm not a spine specialist. The neurosurgeon told me he's not a spine specialist, but this man performs surgery on people's brains and people's spines. So he made a referral to the spine specialist, and I'm supposed to see them next week, and I'm supposed to get an injection 3rd week of October. I'm not satisfied with that. I'm in constant pain. What you see in images and what you read on a report is not going to tell you the amount of pain the patient is in. It's only going to tell you what's wrong with the discs or with the spine or with, the vertebrae, but it's not going to tell you the pain. One person can have a herniated disc and work and exercise and be fine and not even know they have a herniated disc. And another person could have the same herniation in the same spot and be in excruciating pain and not be able to function. Everybody is different. And the fact that I already am compromised because I have a pain disease, I have fibromyalgia, I'm already susceptible to chronic pain. And on top of that, I have all these problems in my back. Makes me different than all the other patients you're seeing. So don't tell me everybody else suffers from things. I'm not everybody else, and I'm telling you I'm in pain. And if I'm coming to you as a patient and telling you I don't want drugs, I don't want pills, then it should show you that I'm not there for drugs. I want a solution, and I feel like you telling me to take more pills and to get more injection is a band-aid solution, because that is not going to help with the fact that my spine is curving, that I'm losing height because my disc is so worn out that they're wedging on each other. So I'm just going to read you a little bit about what's on my MRI. I know you guys are not doctors and I'm not a doctor, but just so you can see why I'm so concerned. And I'm just in a lot of pain. As I sit here, my back feels like it's going to break. So my mid-back, which is my thoracic spine. Well, let's go back. My neck, my cervical spine, I have 2 herniations in my neck alone, in my neck. And my neck is starting to get a hump. I forgot the term for it, but I have kind of like a hump in my neck, and that's from the 2 herniations. That's my neck. Now my mid-back. I have dextroscoliosis, which means that my spine is curving and leaning towards the right. And I knew there was something off with my spine because I kind of like hunched forward, and I was noticing that my right ribs have been hurting a lot. And so when I went to my general doc and I showed her these MRIs, she goes, well, your ribs would be hurting on the right side because your spine is curving and kind of leaning towards the right. I just can't continue to live like this. So scoliosis of my spine. I have global loss of disc signal, which means it's pretty bad. So it shows mild anterior wedging of T8, T9. That's the 8th and 9th vertebrae in my mid-back, which appear chronic in signal. Degenerative end plate changes, as well as Schmerl's nodes. I had no idea what Schmerl's nodes were, and they're kind of like these little abnormal pieces of bone formation that can cause pain on the vertebrae. I have that in several different areas of my spine. I also have hemangiomata, which are the tumors that I was worried about. So hemangiomas are like little blood vessel tumors. So they're little round tumor-like masses that are made up of blood vessels. Some can hemorrhage, some cause no symptoms, and some can cause pain. I have a few of those, and I was a little worried about that, but neither the neurologist or neurosurgeon was worried about that. And it says I have them on a few vertebral bodies, and they also found some renal cysts, and I looked that up, and it's kind of like kidney cysts. I haven't even gone to the doctor regarding that. So the impression from this MRI is I have bulging disc at T5, T6, T7, T8, T9, T10. With multifocal spurring. That means the edges of the vertebrae they're getting like these pointy pieces of bone coming out of it that's kind of rubbing on the bone underneath it or above it, depending on where it's located. So spurring is painful. You can look up what bone spurring is. You can look up what hemangiomata are. You can look up what anterior wedging of vertebrae is for a better understanding. You can look up Schmerl's nodes for a better understanding of that as well. It's a lot of findings, and this is just my mid-back. So no spinal stenosis seen, which is good. In my mid-back, spinal stenosis is kind of like when there's a narrowing of the spinal canal. And you know, if anything injures your spinal canal, it can cause you to become paralyzed, to have loss of bowel and incontinence, and it's not a good thing. So spinal stenosis, I think, is a major issue, and probably requires surgery in all cases. I'm not sure. I'm not a doctor, but yeah, so the bulging at several levels, all those things I just pointed out, the scoliosis, and degenerative disc disease. So my discs are degenerating, and when you have degenerative disc disease, it's basically arthritis in your discs, and it causes pain. I have a lot of pain in my back, like all day, every day. As I'm sitting here, I'm in pain. This is just my mid back. So we'll go on to my lumbar spine, which is your lower back. And here it says again, there's loss of disc signal at L3, L4. And I think when it says loss of disc signal, probably means that the disc is pretty far gone. It's like deteriorated. It says this is at L3, L4, L5, and S1. S1 is your sacroiliac joint. Let's see. It says I have an ovarian cyst that's 2 centimeters. Nothing to do with my spine, but they picked it up on the MRI. I seem to have a problem with cysts in my body. I do have a brain cyst, an arachnoid brain cyst. I do have a cyst in my thyroid. I have an ovarian cyst, and now they found cysts in my kidneys. So I really have to follow up with the doctor regarding that. I don't know why I'm so prone to having cysts in my body. They're not going to remove the brain cyst. They're not going to remove the thyroid cyst. The ovarian cyst usually ruptures on its own, and when it does rupture, it's very painful. I know when it's rupturing because it happens about twice a year for me. This is the biggest one I've ever had, 2 centimeters. So, and it's there. It still hasn't ruptured because I can feel it. Especially a day or two before my period, I have immense pain in my pelvic area. Last time it did rupture a few months ago when I had one, it sent me to the ER. I was in so much pain, and I was bleeding, and I went to the ER, and they told me my cyst had ruptured and nothing was going to be done about it because my body was going to absorb anything that came from the cyst. Yeah. It says besides, the L3, L4, L5, S1, and the cyst, it says that I have a bulging disc at L1 and L2 with spurring again. I have facet joint arthropathic changes. Basically, the discs are getting bad. The joints are bad. No spinal stenosis at this level. At L3 and L4, more bulging discs. And I have a posterior annular tear. So I have a tear in one of the discs, and it's present with spurring and facet joint arthropathic changes. L4, L5, no disc bulging at that level. L5, S1, which is like the lowest part, where kind of what they call the tailbone, I guess. I don't know. The lowest part of the lumbar spine, L5 and S1. I have a disc protrusion at L5, S1, extending into the right neural foramen. Foramen superimposed on bulging disc. So in this part, it is kind of starting to impose a little on the spinal cord. I have spurring, more facet joint arthropathic changes, and it says these findings at L5, S1 are causing narrowing of the right neural foramen at this level. So the impression here says L5, S1, disc protrusion and narrowing of the neural foramen, central focal disc protrusion at L2, L3, causing mild spinal stenosis at this level. So I do have spinal stenosis at L2, L3. Bulging disc at L1, L2, L3, L4. And disc desiccation is noted. So my discs at different levels are like desiccated. We all know what desiccated means. It's just like done for. This is my lower back, guys. So I already told you the herniations in my neck, all the bulges and issues in my mid-back, and now all these issues in my lower back. My spine is, I feel like an 80-year-old with a bad back. I don't know if it sounds like an oxymoron, but not all 80-year-olds have bad backs. But I feel like an 80-year-old with a bad back, not a 37-year-old in her prime. Yes, I'm suffering from fibromyalgia, but this is just a whole other issue. If I can get the spine pain somewhat handled. And then I can continue to be a fibro warrior and try to live a better life. I'm gonna have arthritis. There's no cure for arthritis, but I just need some relief. So when the neurosurgeon and the neurologist basically told me, yeah, your back is bad, but basically they told me I have to continue to live in pain for the rest of my life, and my spine will continue to degenerate and curve because of the scoliosis, to the point where I just may not be able to walk in 5 years. So I contacted the Laser Spine Institute. I send them my MRIs, and I'm waiting for them to review them and tell me if my insurance covers laser spine surgery. And once they get back to me, I'm praying that they tell me that it is covered and that they can help me. And then I'll keep you guys posted. But, you know, as of now, I just continue in pain daily, and I hope that anyone suffering from this type of spine pain stays motivated to get help, because it can be so defeating when you go to a doctor and they make it seem like your problem is not a problem. Like, everybody has these issues. Everybody's spines deteriorate as they get older. Yes, we know that, but not everybody has excruciating pain from their spine. Not everybody has herniations or bulging discs or spinal stenosis or scoliosis or schmurls and nodes or hemangiomas in their spine. Not everybody has that, and it hurts. I'm in pain. My pain is real. And it's sad when no one believes you. I mean, it's like the same issue with fibromyalgia. People just don't believe you, and it's sad. But I'll keep you guys posted on what Laser Spine Institute tells me. Okay? Thanks for watching, guys. And if you have similar issues and you just want someone to lend an ear, you can always add a comment to this video. Okay? Thank you.